to our YouTube channel. Again, I'm Danny.
And I'm Nikki.
Alright, so we're now here to talk about the notorious AMC Part 2 exam, which is the Clinical Examinations. Alright, so again, to give you a quick background about both of us, Nikki and I are now doctors working here in Australia, and we're both IMGs, and we could say that we're quite lucky enough to have passed both the AMC Part 1 and 2 during our first attempt.
Yeah.
Yes, very lucky for us to do that. And basically, we've also been part of those tutors who have taught some candidates how to pass their examinations. Again, both in their clinical examination and their MCQs, but me myself personally, I've been helping people pass their clinicals Part 2. Yeah.
And we've both been examiners as well for mock trial exams.
Yes.
And we've seen a lot of candidates attempt or practice how they would perform in the clinical exam. So we sort of kind of have a lot of experience
for that. So this video is basically our takeaway from our experience, which we hope that could help you guys out again in your journey towards your general registration. Okay, so again, Nikki, so what is the AMC Part 2 or the clinical exam?
So the AMC 2, which is the clinical exam, is used to be a face-to-face exam that you can only take in Melbourne. So everyone from overseas needs to fly to Melbourne to actually take the exam. But because of the current COVID situation and Australia's borders being closed, they actually started the new online clinical examinations just this year, which I have no idea how that's been so far. I guess as soon as we get to find out who's attempted the clinical exams online, we would be able to invite them on our channel and give their experience on how it went. Anyway, they still retain the same structure of the clinical exam anyway.
Yes.
So it's a 20-station exam, 4 stations of which are rest stations, 16 stations are actual stations, 2 of the 16 is
not
pilot stations that you don't score, and the 14 are scored stations, but you don't know which is the pilot and which are the scored stations.
Yes, and basically in order for you to pass the exams, you should pass at least 10 stations. Okay, if your score is a 9, it's an automatic fail.
So it's either a pass or fail.
So
exam.
Even if you did your really good best in one station, if you only scored 9, unfortunately you wouldn't pass the exams. That makes it really hard.
Yes.
Yeah.
And the thing about the clinical exam is, I guess you could say it relies a lot on subjective decisions made by the examiner. So unlike the first exam, which is a computer-based MCQ multiple choice exam, you would obviously have some correct answers, which are definitely correct. But for the clinical exam, it's an examiner or an actual person scoring you. So there's some subjective component to that.
Yeah.
So I think it's very important to learn when you're preparing for the AMC2 what exactly the examiners want to see from you.
Yeah.
Because you can be giving all of the correct answers. What you're saying, what's coming out your mouth could be correct. But if you're not performing in a way that's expected, like you're saying the wrong things, you don't show any empathy, you don't have any rapport, you can still fail the clinical exam.
That's true. That's really true. Each station will be around 10 minutes.
10 minutes.
You are given 2 minutes to read the question outside the door. So usually there's a case and there's some tasks. And after that 2 minutes, the doors will open and you start the assessment time. So basically you need to do all what's asked during the station during those 8 minutes. All right? So basically the stations will involve actual patients or Some are even videotape patients, like they ask you to have a look at this videotape, and depending on that, you'll do your task. Some will also involve a phone call. Yeah? Yeah. All right.
So they will always cover one of each at least. So there will be an adult medicine station, there will be a surgical station, there will be a women's health or obs and gynae, and a pediatric station. And of course, there will always be a physical examination station as well.
True. And usual tasks involved in this would be either history taking, doing a physical examination, diagnostic formulation, which basically means making a diagnosis, then doing differential diagnosis, and also counseling stations, patient education stations, and management cases actually come up. All right?
So just a few tips about tasks in the examination is, especially for history taking stations, the assessment time is very short. It's 8 minutes, and sometimes you would have 2 to 3 tasks that you need to complete in those 8 minutes. So give or take around 2 minutes per task. So let's say one task is history taking. You have to make sure that all the questions you ask are relevant, because you only have 2 minutes to ask your history. So make sure, let's say it's a shortness of breath case, make sure that all your questions about shortness of breath are asking heart failure questions, asthma questions, COPD questions, so your smoking history, occupational exposure, asbestos exposure. So make sure you cover all of that. So it must be a focused history taking, unfortunately, for these kinds of stations.
And for me, on a personal note, I do feel that the AMC clinicals are a very important assessment for doctors who want to practice here in Australia, because basically if you want to be a GP, your time is actually limited, and having a 10-minute assessment with your patient and doing just the relevant questions and relevant exam is very important in your practice. So it's some people say, is it really important? Do we really need to take this? I think it is. All right. So we're gonna share our own personal experience and how we prepared for this exam. So probably Nikki can share what she's gone through, and then I could share mine.
So immediately after passing the AMC 1, I already registered to enroll in a review center in Melbourne. So because I didn't know anything about the clinicals, it was something that I couldn't prepare by myself. So I actually flew overseas going into Melbourne, attended an 8-week course which ran every day from 8 a.m. to 5 p.m. It was a full-time course, and they basically showed me gave me an idea how the clinical exam would look like. There were a lot of tutors there. They would give tips on how to best tackle each case, and the review center usually has 1 or 2 mock trials during the duration of that course, which is really helpful because it actually gives you a feel of how it feels to be in the actual exam, and it's how to perform under pressure and how to manage your time and how to find the right words to talk to your patient. So I also found my study partner in the same review course, and he happened to have the same exam date as I did, so it worked perfectly in terms of us planning our timeline of how many cases we should study a day, because we were going at the same pace, which I think is very important when you're considering a study partner. In terms of resources, I didn't have anything, so all of my resources came from the review center, and mostly what they suggested was you read the Handbook of Clinical Assessment. So it's called AMC Clinical Handbook of Clinical Assessment, and I think you can buy it online from the AMC website, I'm supposing, and it's important to read it back to back. So during the clinical exam, there will probably be 1 or 2 cases in your actual exam that will be coming from that handbook. So it's very important. It's like the Bible of AMC2. What other things?
And taking from that, like I did the same thing as Nikki. I did a clinical course, but mine was about 10 weeks. I think that would be quite enough in order to have that certain gauge of what they would potentially expect you to do in a certain task or in a certain station. And really, we really strongly encourage all you guys to get a really good study partner. You really need to have a partner who's able to give constructive criticisms on your performance. Yes, because I think since you don't really know each other before all this exam happened, some people find it embarrassing to give a good criticism on a candidate's performance. You really have to say, I feel that your approach is not that encouraging. Or I think I couldn't understand the way that you've explained the condition to me when you were explaining what pneumonia was like, for example. You have to really say that I think I'm missing something in your performance, because that is very essential, because that's the only way that you gotta learn on how to perform better. Okay? Again, the Handbook of the Clinical Assessment that's given by the AMC has the important things that you need to take on in history taking, because it says there if it's a history of chest pain, you really have to be able to say where the pain is, how to characterize the pain in order for you to develop those important differential diagnoses, right? Yes. So in my situation, after my clinical review course, I had the luxury of 2 months to study with my study group before I sat my exams, and I felt that was my most intelligent period in my life, because you have to really understand the facts about a disease, but you really have to be comfortable with the English language. I think that's the main battle that all international medical graduates face with. It is how to communicate very well. Yes.
Especially the counseling and education station. So sometimes it may sound simple, like let's say for example, counsel your patient on smoking cessation. May sound simple enough, but once you actually try to explain to the patient why it's good for them to stop, and if you haven't practiced that, or if you haven't made a script for that, you will find it very difficult to explain it properly during the exam itself.
That's true. Yeah. And with time pressure, sometimes your mind can go blank. By the way, that's Sammy, that's Nikki's dog. So she'll be Sammy later on. Okay. All right. So anyway, going back, we feel that it's very important to have a case and try to write your own script for it and time it.
You have to practice timing it. It's not enough to just practice what you're supposed to say. You have to make it in time, because you have to finish all tasks in time, because if you fail to do a task, then it's basically you failed the station.
Yes, that's true.
For the resources, definitely read from cover to cover the AMC Handbook of Clinical Assessment. There are other informal resources out there. They're called Karen's Notes, which is Karen is actually a candidate who sat the AMC exams, and she just happened to have really good notes. It was passed from generation to generation of candidates, and now it's being shared in Facebook groups. It can be a little bit outdated, of course, but it's still a pretty good resource.
Yes.
Another popular one you might have heard would be Marwan's Notes. Same like Karen's Notes, but I guess a little bit more updated. So all these files you usually find in AMC2 Facebook groups. They're usually in the files section, or if you post a comment somewhere, someone will just share it with you.
Yes.
So it's pretty widespread.
Yeah.
In terms of timeline, how much time you need to prepare for AMC2, I think it's different from person to person, depending, I guess, on your personal situation. So I understand some people are working a full-time job that they can't leave, they have family, they have kids. So sometimes those people will need a longer time just because they can only study for short periods of time in a day. So in that case, probably half a year to a year of preparation. But I guess if you don't have any commitments, you're not working, you don't have kids, and you can really do full-time studying, I would say around 4 to 5 months.
Would be enough.
Would
Even
be
more
enough.
than a month. Enough.
Yeah.
Yes. And apart from that, just be comfortable speaking in English, I guess. And you have to be sensitive about body language and cues that the patient or the examiner might give during your exam period. So if you could see that they're tearing up, or if you could see that they're looking downcast, their eyes are downcast, you have to acknowledge it. You have to say, are you feeling all right? Or is there anything that I can help you with? Or you can even like say, you look quite distressed. Can I do something to help you out? I think the tone and how you say those words will really establish good patient rapport and will actually put your points up. Yeah.
So this is what I realized about the clinical examination is, so you have 20 stations, right? So that means you have 20 candidates attempting the test together with you. Of course, all of those 20 candidates have studied the cases and they all know the answers as well. They know the differentials, they know the management part. All of you know the same knowledge. But what separates the passers from those who fail will actually come down to rapport, how you interact with the patient, how sensitive you are, what kind of words you use, and how you look, your
approach and your facial expression actually matter.
So it doesn't matter if you say the right things, but if you come across as rude and arrogant, you're really not going to pass the exam.
And the worst thing to have is actually a nervous doctor. So have a think. If you're the patient and you can see that your doctor is just so stressed and agitated and nervous, you wouldn't really feel confident about getting their advice, right?
Yeah.
So you have to be just calm, just ask the patient how you can help them, and really establish that good patient rapport. Checking their understanding every now and then is very important. I felt that while I was explaining the condition to my patient, I always ask, is there anything that you want me to clarify about what I've said? Or do you have any questions so far? Because that's actually acknowledging that your patient is totally in a completely different level with you in terms of medical knowledge, but you're putting it at your certain level so that they could also have that power and understanding about their clinical situation.
And one thing that the review center taught me before was to never use medical jargon.
Yes.
I mean, you have to make sure that the words you use is something that the patient can use. And if you have the opportunity to draw for the patient, let's say, so it helps them understand the situation. Like, let's say you have gallbladder stones, you can try drawing the liver and the gallbladder and draw little stones there. That helps a lot.
Yes, that helps a lot. Yeah. And I feel in practice, given that we're working both in a GP setting now, it's very helpful as well for our patients to understand their current clinical conditions when we show images to them. Yeah.
So the AMC2 is very notorious for having a low passing rate. Usually some sites say 10%, some sites say 20 to 30%. So a lot of people message me asking me, is it really worth it attempting AMC2? They don't want to spend that much money and then just fail. Well, I usually tell my friends, you will never know if you never try.
Yes.
So you can, it's, some people will say it's difficult, but how will you know if it's difficult if you don't do the exam yourself?
That's true.
Besides, when you're preparing for the exam, you're preparing to be successful. You're not preparing for failure. So you shouldn't be going into the AMC2 exam thinking of the worst outcome. You have to go into it and prepare for it with the mindset of you're going to pass this. And I think the main reason why people fail the AMC2 is because they don't have the correct guidance of how to study and prepare for it. So they keep on attempting it, doing the same thing. They would say, oh, I've attempted AMC2 4 times and I still failed. Well, they're probably doing the same mistakes again and again.
Yeah.
But if you find people who actually pass the exam and get tips from them, then you are most likely to pass the exam. So it's all about finding the right people to talk to so that you can pass your exam.
That's true. Yeah, I completely agree with Nikki. So hopefully we have helped you somehow to have this idea of what the clinical examination is about. So again, we really strongly encourage you to email us about any questions or any topics you want us to discuss. And please like and subscribe in our channel, and you should watch out for more discussions. We're looking forward to develop an episode about how to find jobs here and share our personal journeys as well. So again, thank you very much.
Thanks for listening, and we'll see you in our next video.
See ya!
Bye.
Bye!
In the correct format and based on Australian CV writing standards, because you don't want to be sending 50 or 100 applications